In this video, I'm going to share with you the 3 exams every nurse must write, especially if you want to practice nursing abroad. Welcome back. If you are new to my channel, my name is Sister Kwajima. You can simply call me Kobe. And if today is your first time seeing my channel, I really appreciate you for being here for the first time. And I believe that you have not subscribed to this channel yet, so please hit the subscribe button right under this video and then become part of the family. We learn together. If you are looking forward to practice nursing in the UK or midwifery in here, there are a couple of exams you have to write. There are 3 of them, and that's what I'm going to share with you. Now, if you can watch this video to the end, there are a couple of things you will learn. You get to discover the purpose for each of the exams I'll talk about. You also get to know the fees involved. How much do you have to pay to register for such exams? And I also talk about the available test centers. So if you are ready to register for any one of them, where do you go? And I also mention where you can get available practice materials. I'll try as much as possible to give a bit of advice to anyone who is writing each one of these tests. I must say that every link you need has been left in the description box of this video, so please check it out. Okay, so before we dive into talking about each one of these exams, I want you to understand that they are limited to international nurses or nurses from outside the UK. The first exams I will talk about is termed as English Language Proficiency Test. This consists of IELTS and OET. You would have to write one of these. It's either you are writing the IELTS or the OET. IELTS stands for International English Language Testing System, and the OET is the acronym for Occupational English Test. The purpose of you writing an English Language Proficiency Test, whether the IELTS or the OET, is to prove that you can effectively communicate in English, especially if you are planning to work as a nurse in the USA, the UK, and other English-speaking countries. You are required to sit for one of these exams. And one thing I will say is that to be ordered to write an English Language Proficiency Test means that you are coming from a non-majority English-speaking country. Especially most African countries are considered to be non-majority English-speaking countries. So if you are seeking to work in the UK, in the USA, Canada, probably they would want you to sit for one of these exams. Now let's talk about the institutions that organize IELTS. If you are looking forward to write the IELTS, there are 3 institutions that are mandated to organize IELTS. The first one is the British Council, which happens to be the most common one that most people use. And then we have IELTS IDP Australia, and then Cambridge Assessment. And turning our attention to the OET, it is owned by the Cambridge Box Hill Language Assessment Unit Trust, which is CBLA. So the question is, who can write IELTS or OET? If you are contemplating on which one to choose, first of all, I want you to understand that IELTS is a generalized exam. So what this means is that it can be written by everybody regardless of your age, your gender, your social class, your race. But then with OET, it is limited to certain specific people. Unlike the IELTS, the OET is written by healthcare professionals. It is limited to 12 healthcare professionals. And these healthcare professionals include nurses, pharmacists, dentists, doctors, and then the likes. Whichever of these exams you want to write, you need to prepare adequately to get the score you are looking out for. And also don't forget that every institution requires a certain specific score. So before you register for each one of these exams, you have to make sure that you know the institutions for which you'll be using the results for, so that you get to know the scores they are requiring from you, and then you can prepare as such. I know at this point you are patiently waiting for the grading system. How is IELTS scored and how is OET scored? When you get into IELTS, you realize that it is scored in band scales. So it starts from band 0 to band 9, where band 0 is the lowest score, then band 9 is the highest score. And if you score band 9, it means that you are a competent English user. And the OET is graded from A to E, where A is the highest score and then E is the lowest score. So you have to take that into consideration. And then both tests consist of 4 aspects. So if you are writing the IELTS, you'll be meeting the listening test, the reading test, the speaking test, as well as the writing test. And then the same thing applies to the OET. Now, let's talk about one important thing, which is the cost involved. So the question is, how much do you need to register for IELTS? And then how much do you need to register for OET? The cost varies from country to country. What this means is that the cost as per Ghana will be different from that of Nigeria. So depending on wherever you are, you have to first of all identify the institution you are going in for. Are you using the British Council? Are you using IDP? Or you are using the Cambridge Assessment? Just visit their website and then check how much you have to pay. And about the OET, it also varies from country to country. So just go to their website and then check how much you have to pay for the exams. When you fail IELTS or OET, there are a couple of things I would want you to know. Failing IELTS or OET doesn't really mean that you have failed totally. You see, the concept of failing these exams has to do with the institution you're applying for. As I said, every institution requires a certain score. So let's say if you want to register with the UK NMC, you are supposed to get this score. When you write the IELTS or the OET and you don't get that score, what this means is that you have failed in that regard and you can't register with the UK NMC. But then remember that for that score you have, it may be applicable to other institutions, but because you don't have interest in there, you have to re-register and then get the score the UK NMC is looking out for. So this is one thing you have to understand. You see, you've got to write 4 aspects, which is the listening, reading, writing, and then the speaking. So let's say you failed in the listening test. What this means is that you have to write the whole 4 sessions again. You are not only allowed to write the listening test. It doesn't really happen that way. And that is why most people do fear to write either IELTS or OET, because when you fail in one, you have to write all of them again. Now, my advice to you is that you see, read more about each one of them before you register. That's the first thing I will say. I also say that if you want more tips on the IELTS, please check my channel. I've got tons and tons of videos on that. And then let me mention that if you want to learn the strategies for conquering the IELTS reading test, probably check my full IELTS reading course. These are the strategies that did help me get the band score I was looking out for. So if you want to tap into that, just check in the description box for the link to that course. Number 2 is CBT. CBT stands for Computer Based Test, and it is the first part of the test of competence. There are 2 tests of competencies. CBT is the first part. I'll talk about the second part next. Now, the purpose of CBT is to assess your knowledge. Okay, is to assess the knowledge of people who want to apply to join the UK NMC's register from overseas. So if you are trained outside the UK and then you want to come here and work as a registered nurse or midwife, probably you have to sit for these exams. And one important thing you have to know is that the CBT is usually written in your home country. So if you are from Ghana, you have to write your CBT in there. If you are from Nigeria, you have to write your CBT in there. So wherever you are from, you have to identify the test center and then write aside. The CBT consists of 2 parts. We have part A and then part B. Part A is classed as numeracy. So as the name implies, you are dealing with numbers. What this means is that you'll be dealing with dry calculations and all those stuff. And it lasts for just 30 minutes and you're supposed to answer 15 questions. And the part B deals with clinical multiple choice questions relating to nursing or midwifery. And here you have 2 hours, 30 minutes to finish that. And you are supposed to answer 100 questions. So take that into consideration. So all in all, you are answering 115 questions in the CBT. One may ask, how much do I need to register for the CBT? You see, there's a fixed amount you have to pay depending on wherever you are coming from. And it is £83. So you have to do the conversion in your currency to see how much you have to pay for that. So how do you book for the CBT? Once you start your UK NMC registration, you go through verification process. Now, this process is for the UK NMC to reach back to your home country NMC to find out if you are fit to practice as a nurse, or if you're a registered nurse working in that country and that you are fit to practice as a nurse in the UK. Once this is confirmed, you get an email from the institution that organizes CBT and an account will be created for you. All you have to do is to log in and then book for the test. The institution that organizes CBT is called Pearson VUE, and there are available test centers in most countries around the world. So obviously you have to just check if you've got a center in your country. if you fail the CBT, unlike the IELTS or the OET that you have to write all the aspect again, here, depending on the part you failed, you have to write. So let's say you failed in part A, which is the numeracy. You had issues with track calculation and that you didn't attain the score you are looking out for. You only have to sit for the part A. Or let's say you failed in part B, which has to do with the clinical multiple choice question. You have to only sit for part B. But the issue here is that you have to pay different amounts for each part you are resitting. For example, if you failed in part A only, you are paying £50. And then if you failed in part B only, you pay £70. But then if you failed in both, you pay the same amount, £83, for which you registered with. And then the grading system is just in two folds. It's either you are passing or you are failing. So when you write the CBT within 24 hours, you should have your results. Now the results will be displayed on your NMC online portal. So when you log into your NMC online account, you see either passed or failed. And at this point, where do you get practice materials? You see, to get practice materials, there are a lot of places you can sort for. But then remember that not all are genuine. But what I can say is that check in the description box of this video for the links to get enough CBT practice materials for yourself. What advice will I give if you are preparing for the CBT? What I will say is that first of all, prepare very well before you sit for the exams. You see, remember that it is unusual for you to fail CBT. About 99.9% of people who write CBT pass. What this means is that it's not really difficult. You can easily pass, but that doesn't mean that people have not failed. There are a couple of people who have failed the exams, and it's all because they didn't prepare very well. So just make sure that at least you are putting in your maximum best so that you can pass once and for all and not have to waste away £83. Now I'm going to talk about the third exams. I call it the Majesty. It's the Ogboro. So it's the exams you have to write to get your pin. Okay, despite the fact that you have written IELTS and CBT, if you don't write that, your pin will not be released. That's why I call it the Majesty. So this exam is called OSCE. It stands for Objective Structured Clinical Examination. It is the second part of the test of competence. Remember, the CBT is the first part. And this is the practical version of the CBT you wrote in your home country. The reason why OSCE is written is to assess the clinical skills of people who want to apply to join the UK NMC register from overseas. You know, one thing about the OSCE is that it is only written in the UK. You can't write that in your home country. So for most employers, before they get you a job, they would want you to have only OSCE left to write, so that when you come in here, you can have that done. How do you book for the OSCE? Once you receive a decision letter from the UK NMC, you are authorized to sit for the CBT and then the OSCE, which happens to be the test of competence. Okay, it is the responsibility of your employer to prepare you for the test. So for some employers would want to prepare you for like 3 weeks, others would want to prepare you for 1 week, others would want to prepare you for 1 month. So it depends on the NHS trust or the nursing care home you have gotten a job. There are 5 approved test centers. We have the Oxford Brookes University, we have University of Northampton, and then Ulster University. We also have Northumbria University, and the last test center is Leeds Teaching Hospital NHS Trust. So these are the 5 test centers available in the UK. I know at this point you are asking, what does this test entail? What is it all about? Okay, so as I said, it's to test your clinical skills. Okay, so when you come in here and you have to write your OSCE, obviously you are going to sit for 10 stations. The first 4 stations has to do with nursing process. So what happens here is that you have to assess a patient, you have to draw a care plan, you have to implement the plan and then evaluate. So it is called API. And the other 4 stations will have to test your skills. So for example, you can be asked to give a subcut injection, intramuscular injection, you can be asked to flash a cannula, you can be asked to take a sample from a catheter. I mean, there are a whole lot of skills that you have to learn to be able to go through this process, and remember, you'll be trained for that. Now, the 2 stations will have to assess candidates' values and then behaviors, as well as evidence-based practice. You'll be prepared for it, so you don't have to be scared about it. How much do you need to book for the OSCE? So currently, to book for OSCE, you're supposed to pay an amount of £794. So you can do the conversion in your home currency and then you see how much you have to pay. But then the good aspect of this is that most times the employer will foot this fee for you, so you don't have to worry about it. But the other aspect is that if you fail in any of the stations, you have to pay yourself to resit. And if you are resitting like 7 stations or less, you are paying £397. And something more than 7 stations, you'll be paying the usual amount, which is £794. How many times do you have to write the OSCE for an employer to say that, okay, you couldn't pass, so we are sending you back to your home country? Let's talk about that. According to the UK NMC, you are mandated to write OSCE 3 times. Now, you may go your second and then third attempt if you fail in some of the stations. So there are some people who only pass on the third attempt. The UK NMC will have to close your application and then you need to start a new application if you want to register with the UK NMC. So at this point, most employers will think of sending you back home to start the whole process again. So you have to obviously be very mindful of that and then put in your best to prepare. What advice will I give you as an overseas nurse who is preparing for OSCE? So I would say that as an overseas nurse, the OSCE determines your stay in the UK. As I said, if you fail on 3 occasions, you see that you are going back to your home country, and that won't be a good feeling for you. If you pass all the stations, you receive an email with details of what to do next. After some weeks, you get your PIN, your NMC PIN, and you become a registered nurse or midwife in the UK. So what I would advise you do is that please give out your all. When you come in here, I know the feeling of UK, all those tasks will make you much more excited, but dump that excitement somewhere, then focus on the OSCE. Once you pass the OSCE, you can enjoy every bit of it. Okay, you can do whatever you want to do because that determines your stability. It's an indication that you are not going back to your country. You are staying in here to pursue your nursing or midwifery career. Where do you get practice materials? What I would say is that to get practice materials for your OSCE, so most times the hospital you are working for will have OSCE trainers. They would obviously give you the practice materials based on the test center that is linked to the hospital. And for some hospitals, they just look at which test center has got available slots and then they will just book their candidates. So some hospitals haven't got any specific test center. I strongly believe that we have come far. You've learned a lot from this video. You've now got to know the 3 exams and why you have to write them, the fees you have to pay, and a whole lot of that. If there's anything I didn't say, or if you've got any question, please don't forget to leave that in the comment section. I'll answer them all for you. Thank you very much and hope to see you in my next video.